Let me ask you this. You're an advocate of libertarianism and individualism, American individualism. What about that concept when it's used as an argument for not wearing a mask in the interest of public health? And no government can tell me what to put on my face. So we see that again and again and repeated again and again. And people are using weapons when they march in the street advocating that they're simply not going to tolerate that kind of thing. And when they do that, of course, we are all subject to the spread of disease. What happens? What do you say to people who have that position?
I say the following. I am, as you say, libertarian-ish, which is to say I believe that before the government interferes with the freedom of the individual, it ought to have a good reason and ought to say what it is. Well, a communicable disease is a really good reason. I'm a lapsed professor of political philosophy. I went to Oxford to study. I got a PhD at Princeton and briefly taught political philosophy. And one of the texts you read as a political philosopher is John Stuart Mill's On Liberty, who said there's a distinction to be drawn between self-regarding acts, those are acts that don't affect other people, and other regarding acts. Carrying COVID-19 is obviously an other regarding act. And this is such an easy measure to take. This idea, this kind of, I call it country music manliness on the part of people who won't wear a mask. You know the country music lyrics. I'm a bass fishing, truck driving, beer drinking, good old boy, and no one can interfere with my liberty. This is a minor excision from your liberty, and it will save your life and perhaps that of your friends.
Well, that's persuasive to me, but it doesn't seem to have been persuasive to a lot of Americans and not to a lot of members of Congress, including members of the Senate, who have apparently spread the disease in the chambers of the Senate. So again, how can you expect that party and the members of that party to lead in such a way that millions of people will be willing to deal with the disease the way we ought to deal with it?
I understand the problem. I think that the most instructive teaching that is being done is by the numbers we see every morning on television as we pass 250,000 deaths. There are some people you just can't reach. It's a Darwinian moment, and we're going to find out who's going to be fit to survive and who isn't.